Hello friends, hi, good morning. Welcome to our channel, The Voice of Nurse. New beginning, note subjects friend. Today we are discussion regarding staff nurse previous year model paper with explanation, questions and answers with explanation. Now we will discuss here. From this video onwards, I am hiding the answer, means I will not project the answer. I will explain all the things about the question and answers. Then finally I will project the answer. Why? Because of you people have to know what is the answer. You people have to guess what is the exact answer. Then I will, after finishing the explanation, I will project the option of answer. Then you people know what is your level of knowledge regarding questions and answers. Before moving on to topic, a small request friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. And one more thing I have to tell my friends, please while watching the video, please give a one comment and like friends, because I have to know whether it is useful or not for the nursing staff or any students from the nursing background. So friends, please like a video, share the video. Let's move on to topic. Staff nurse previous year's papers with explanation. The first question is, which one of the following indices a nurse has to consider as an indicator of good nutrition? From the options, nurse has to consider as indication of a good nutrition. From the values, we have to know what is normal. Here we have to know what is nutrition. Nutrition is defined as the science of food and its relationship to health. Nutrients play important role in the growth and development of our body. Good nutrition. Good nutrition stands for the supply of essential nutrients in adequate quantities. The normal range of albumin is a ratio of 1.1 to 2.5 grams per dl, considered as normal. So here albumin level is 2.5 grams per dl is here considered as normal value. The above is 2.5 is high albumin levels in blood. So here 2.5 gm per dl albumin level is correct answer. Next move on to second question. Before endotracheal intubation, some facts about trachea a nurse has to understand, and all the following are true regarding trachea except before ET intubation, means endotracheal tube intubation. The trachea, about trachea, the nurse have to understand some of the points regarding the trachea. From the following except, means from the following one is the except related to endotracheal intubation trachea about topic. Here we will see here options. Option A, it's about 13 centimeters long. Option B, it bifurcate into two major bronchi. Option C, it starts at the level of 7th cervical vertebrae. Option D, it ends at the level of sternal angle of Lewis. The trachea is a windpipe that stretches to the top of the chest from the lower edge of the larynx. It has cartilage structure that holds it open. The average tracheal length is 10 to 12 centimeters. The average tracheal length is 10 to 12 centimeters. So here option A is wrong. So here except included option A, it is about 13 centimeters long. This is the except related to the trachea. Nurse have to know the endotracheal intubation. Before endotracheal intubation, some of the condition regarding the trachea understanding points are true points are option B, option C and option D. A is the except here. Next move on to question number 3. When assessing a patient with appendicitis, how a nurse must initiate to get information. Assessing patient with appendicitis, how the nurse will initiate the information from the patient. We will see the options here. Option A, tell me how you are feeling. Option B, tell me where is the pain. Option C, tell me relief of pain with what. Option D, tell me whether cough aggravates pain. Appendicitis is mostly characterized by intense of abdominal pain. Appendicitis we can assess through the MC Burney's pain. To assess the pain level through this method of MC Burney's method, we can assess the appendicitis pain level. It is MC Burney's scale. Means if we have to assess the pain, means to check the location of the pain and apply pressure. There is no pain, but after removing the pressure or after removing the hand from the area, they will be feel pain. Means that is a positive MC Burney's scale. This is positive sign for the appendicitis. So here the nurse have to collect information from the patient through the tell me how you are feeling. Through this method, the nurse can gather information from the patient directly. So here option A is the correct answer. To assessing patient with appendicitis, nurse have to initiate to get information from the patient. Tell me how you are feeling. So here option A is the correct answer. Next we will move on to question number 4. Here most of the questions we got from the medical surgical nursing point of view. Why? Because of in medical surgical nursing we are studying about medical conditions and surgical conditions and related to the nursing also. So these many we are covering in medical surgical nursing. Next here we will discuss fourth question. Which guidelines a nurse has to follow when caring for pressure sore? The guidelines nurse has to follow caring of pressure sore. Here pressure sore means bed sore. We will see here options. Option A, wound must remain moist. Option B, tight packing of the wound. Option C, dressing to dry before removal. Option D, plastic sheet type of dressing for cover. Regarding bed sore, related to the questions we already discussed in the medical surgical nursing point of view. Just check it once friends. I will keep description. In description I will keep it link of medical surgical nursing part 1, part 2, part 3 videos. Those are also important questions regarding the nursing point of view, medical surgical nursing subject. Keep the pressure sore area clean and dry. Always look for redness and numbness. Provide air mattress. Use pillows to reduce pressure, changing position to reduce the pressure sore. The pressure sore on a particular area, we have to use pillows and we have to give support through the pillows, and every second hourly we have to change the position of the patient with bed sore, and have to play important role in the care of the bed sore patient. We have to keep the area dressing to dry before removal. So here option C is the correct answer. Dressing to dry before removal is take care of pressure sore. Next move on to question number 5. This is fifth question, not fourth question. I did a mistake here. What should be the position of the limb a nurse should maintain in a patient who had undergone right hip prosthesis surgery? Patient undergone hip prosthesis surgery. So the position of the limbs, nurse should maintain which position for the limb? We will see here options. Option A, adduction. Option B, abduction. Option C, flexion. And option D, neutral. Patient undergone a prosthesis surgery or hip prosthesis surgery. Specific precautions for a total hip patient include restriction for the position. Mean patients or includes restriction on the position of the hip after the surgery. The hip should not be flexed because dislocation may occur. Which positions the dislocations will occur? Means adduction, abduction, through the flexion. These positions, if we are keeping the position, means the dislocation may occur. So here neutral. Option D is the correct answer. We have to keep a neutral position. Next move on to question number 6. When a post-operative patient develops evisceration, what a nurse should do? Post-operative patient develops a evisceration. The nurse role, what is the from the options? Option A, provide moral support. Option B, ask patient to drink more water. Option C, push the protruding organs inside. Option D, cover the protruding organs. What is evisceration? Evisceration means to take out the entrails of the particular area. And evisceration is a surgical emergency and needs to treat immediately. Evisceration is found means the nurse should immediately notify and provider and cover the wound with a non-adherent dressing that is pre-moistened with sterile normal saline. So here option D is the correct answer. Cover the protruding organs. The nurse role is have to cover the protruding organs. Example for the evisceration is evisceration with keratectomy. Next move on to question number 7. A nurse is caring for an old lady with osteoarthritis and all the following facts are true regarding osteoarthritis except from the options. Here one is wrong option is there related to the osteoarthritis. Here we will see options first. Option A, crepitus. Option B, topy. Option C, subcutaneous nodules. Option D, pain at joints. Option B, topy is a Latin word. Meaning of topy is stone. Here we are having osteoarthritis means subcutaneous nodules will be there and pain at joints and crepitus also present. So here trophy is the except. Here trophy are stone like deposits of monosodium urate in soft tissues, synovial tissues or in the bones near the joints. So here trophy is except related to the osteoarthritis. Next we will move on to question number 8. How a nurse will teach breathing exercise for a patient with chronic bronchitis. The health education related to the breathing exercises for a patient with chronic bronchitis. Options. Option A, use chest breathing. Option B, use diaphragmatic breathing. Option C, use deep inhalation breathing. And option D, all of the above. These all are the related to the breathing exercises for chronic bronchitis. Here option B, use diaphragmatic breathing is helpful to the breathing exercises for the chronic bronchitis patient. How we will provide diaphragmatic breathing to the patient as a nurse? We can help strengthen certain muscles to breathe well in chronic bronchitis. How we will provide this breathing exercise means to place one hand on the stomach just below the ribs and place other hand on the chest bone in the middle of the chest. Breathe in slowly. Ask patient to breathe slowly through the nose and taking as deep breath as can. How can he will take breath? Ask him to take deep breath and ask him to exhale slowly through the dry lips as you exhale. How much he will exhale, that much he have to expel slowly through the lips. Tighten the abdominal muscles. Use hand to gently push in up while tightening the muscles. May needed to practice several times for a day. This is important and useful breathing exercise for patient with chronic bronchitis. Option B, use diaphragmatic breathing. Next move on to question number 9. A nurse caring for a head injury comatose patient. Which intervention he or she should implement to prevent increased intracranial pressure? A nurse is caring patient with head injury. Patient is on coma. The nursing interventions to implement prevent increased intracranial pressure. We will see here options. Option A, maintain well lowered room. Option B, maintain round the clock suctioning. Option C, change the position round the clock. Option D, elevate the head end of the patient. Nursing interventions regarding caring for a head injury patient. Patient is coma means interventions that a nurse can use the low or stabilize intracranial pressure, including elevating head of the bed to 30 degrees angle, keeping bed in a neutral position, maintaining normal body temperature, and preventing a volume for the maintaining fluid overload. Means we have to elevate the head end of the patient. So here option D is the correct answer. Next question, 10th question. What recommendation a nurse should give to 55 years old patient with blood pressure of 150 by 90 mm of Hg? The patient is having 150 90 mm of Hg. The patient age is 55 years old, means older adult. We will see here options. Option A, it is normal blood pressure for your age. Option B, recheck your BP after 2 weeks. Option C, recheck your BP after 6 months. Option D, none of the above. The isolated systolic hypertension occurs in older adults. Often the systolic is 130 or higher, but the diastolic is less than 80 mm of Hg is normal. It is due to the age-related stiffening of the major arteries in the heart. High blood pressure in older adults can lead to serious health problems. So here nurse have to explain patient it is normal BP for your age. Option A is the correct answer. Next we will move on to 11th question. A nurse is caring an anemic patient. What feeding should suggest her that it is acute blood loss anemia? The nurse is caring anemic patient. What feeding should suggest her for the acute blood loss of anemia? We will see here option. Option A, exertional dyspnea. Option B, easy fatigue on exertion. Option B, bradycardia at rest. Option D, postural hypotension. Anemic means having less hemoglobin or iron levels in the blood is low. Somebody having less hemoglobin or iron levels in the blood is less mean they will call as anemic patient. So here what is normal hemoglobin in male and female we will see here. The normal hemoglobin for men 13.5 to 17.5 mg for dl is the normal. Normal HB for women is 12 to 15.5 mg for dl. According to the books, according to author, that range will be different, not exactly here. But if patient is having anemic means acute blood loss anemia means in most of the cases they are a reason for the fatigue and exertion. Here option B is the correct answer. Next we will move on to 12th question. Which patient is having very high risk for developing ovarian cancer? Means which age group of people is having risk for developing ovarian cancer? We will see here option. Option A, 30 years old and oral contraceptives. Option B, 36 years old who had first child at 22 years. Option C, 45 years old who has never been pregnant. Option D, none of the above. The risk of developing ovarian cancer is increases as a woman gets older age. Nulliparity is one of the major risk factors for developing ovarian cancer due to the continuous ovulation associated with nulliparity increasing the likelihood of ovarian malignancy. So the correct option here, option C is the correct answer. 45 years old who has never been pregnant. Option C here, they will develop a ovarian cancer risk age group. Next we will move on to question number 13. Which joint movement is restricted in a patient with Pericapsulitis of shoulder. The joint movement we have to restrict in some of the patient with pericapsulitis of shoulder. Which of the position, which of the movement we have to restrict from the options? Option A, adduction, option B, abduction, option C, flexion, and option D, extension. What is pericapsulitis? We have to know first. Pericapsulitis means the shoulder joint movement is restricted. It is also known as frozen shoulder or adhesive capsulitis. This is one of the painful conditions. The movement that is most severely inhibited is external rotation and adduction. Here option A is the correct answer, adduction of the shoulder. Option A is the correct answer here. Next we will move on to question number 14. Maternity nurse must be aware that screening for diabetes mellitus in pregnancy is done at. Remember friends, we already discussed this question in the midwifery of nursing questions of 100. In between we got this question also. Here we will discuss here maternity nurse must have to aware screening for diabetes mellitus which weeks of the pregnancy. We will see here options. Option A 6 to 17 weeks, option B 18 to 23 weeks, option C 24 to 28 weeks, option D 29 to 32 weeks. GDM, gestational diabetes mellitus, usually develops around the 24th week of pregnancy. So probably we have to check, we have to test it between the 24 to 28 weeks of pregnancy gestational period. Option C 24 to 28 weeks is the correct answer. How we will check gestational diabetes mellitus means we have to test like GTT, glucose tolerant test. Through the glucose tolerant test we can assess the diabetes mellitus in the pregnancy period. Oral glucose challenge test will followed by the oral glucose tolerance test will be there. These all are the two types of the GDM test. Next we will move on to question number 15. Neonate of diabetic mother is at risk of from the following except. We will see here options. Option A hypoglycemia, option B hypocalcemia, option C hyperglycemia, option D hyperbilirubinemia. Infant of diabetic mothers may have major birth defects in the related all the systems of the body. What means related to the cardiovascular system and blood vessels and also brain, spine and urinary system and also kidneys and digestive system. So here the diabetic mother having neonate means the except condition is hypoglycemia, because of they will not be hypoglycemic, they will having maybe hyperglycemia. Here option A is the except condition of neonate of diabetic mother, risk for the hypoglycemia. Next here we will move on to question number 16. Before giving blood transfusion, a nurse must note the date, time of collection and must be aware that packed RBC can be stored up to. This question already we discussed in the medical surgical nursing point of view, question number 45. So here there is no need of detailed explanation for this question. Just check it once in medical surgical nursing friends. I will keep it in links in the description. Briefly we will discuss here packed RBC are stored in blood bank refrigerator at temperature of 1 to 6 degrees in the 42 days of the period. So here nearby 42 days is there, option C 45 days. Here option C is the correct answer. Next move on to question number 17. A patient with noisy breathing, nurse suspect laryngospasm with stridor and it occurs commonly with. This question also we already discussed in medical surgical nursing point of view part 2. Part 3 we already discussed from the 60 to 40 100 questions. 40 questions we discussed in part 3. Here there is no detailed explanation from this question. Just check it once in medical surgical nursing point of view part 3 video. Shortly I will tell the 17th question answer is hypocalcemia. Option D is the correct answer here. Next we will move on to question number 18. Nurse working in an operation theatre must know the risk of HIV infection with needle stick injury is about. We will see here options. Option A 1 is to 100, option B 1 is to 200, option C 1 is to 300, option D 1 is to 400. The nurse working in an operation theatre must know the risk of HIV infection with needle stick injury is about 1 is to 300. So here option C is the correct answer. Exposure of HIV infected blood is 0.3%. For example, in every 300 cases is needle stick injury is 1, means 1 is to 300. 99.9% of needle stick or cut exposure do not lead to the infection. So here option C 1 is to 300 percentage. The nurse have to know the HIV risk related to the needle stick injuries. Next we will move on to question number 19. The 19th question, drug of choice for swine flu. We already discussed this question also in medical surgical nursing point of view part 2. Question number 39 friends. Just check it once. H1N1 influenza is also called as swine flu. Here option A acyclovir, option B edinofovir, option C cidovir, option D oseltamivir. Option D oseltamivir is the drug of choice for swine flu. Next we will move on to continuous question 20. A nurse is taking care of a patient with DVT and she must be aware that venous emboli will be lodged in. The nurse taking care of a patient with DVT, deep vein thrombosis. Deep vein thrombosis, she must have to aware about the venous emboli will be lodged in which area of the our body, means which organ of the our body. We will see here option. Option A heart, option B lungs, option C liver and option D kidneys. A pulmonary embolism usually occurs when a blood clot is called as deep vein thrombosis DVT. Often in the legs travels into the lungs and blocks a blood vessel. The most serious complication of DVT is a pulmonary embolism. The clot in the lungs can stop blood circulation is medical emergency is called as pulmonary embolism. So here lungs is the correct answer. Nurse taking care of a patient with DVT, she must be aware of venous emboli will lodged in lungs. Option B here correct answer. Next we will move on to question number 21. Hyaline membrane disease of a infant is due to deficiency of surfactant and source of pulmonary surfactant is options. Option A alveolar macrophages, option B capillary endothelium, option C pneumonocytes type 1, option D pneumonocytes type 2. What is hyaline membrane disease? Hyaline membrane disease is also known as respiratory distress syndrome RDS. Respiratory distress syndrome. Type 2 pneumocytes are identified as the synthesizing cells of the alveolar surfactant. RDS. Respiratory distress syndrome most commonly occurs in newborns before 37 weeks of gestation. So here option D is the correct answer. Pneumonocytes type 2 is the correct answer here. Option D. Next move on to question number 22. Which one of the following is a DNA virus? Options. Option A hepatitis A, option B hepatitis B, option C hepatitis C, option D hepatitis D. Hepatitis B is a member of the HepaDNA viruses group. Double-stranded DNA virus is called as hepatitis B. Here option B is the correct answer. This 22 question we already discussed in medical surgical nursing point of view. Question number 40. Next move on to question number 23rd. For a percussion and postural drainage of lungs in bronchitis, which position is suggested to the patient? We will see here option. Option A supine position, option B prone position, option C semi-flowers position, option D lithotomy position. The supine position is the best position for the percussion and postal drainage of lungs to drain extra fluid from the lungs. So here option A is the correct answer, supine position. This question we already discussed in medical surgical nursing point of view. Question number 46, the part 2. Next we will move on to question number 24. Patient on enalapril and diuretic therapy for heart failure. Nurse should notify the physician that the therapy is not effective when she finds patient is having heart failure. Patient is on therapy of enalapril and diuretic. That therapy is not applicable to the patient. The nurse finds from the options what will find. We will see here option A dry cough, option B skin rash, option C edema legs, option D postal fall in BP. Patient with chronic heart failure, angiotensin converting enzymes ACE inhibitors and also diuretics are used such as captopril, enalapril and quinapril to improve the hemodynamics and reduce symptoms of the fatigue and dyspnea, correct the hyponatremia also. This medication will correct the hyponatremia. But this medicine also having help to minimize one of the side effects of calcium channel blockers, which the swallowing in the ankles and leg edema. So here we can see the option C correct answer, edema of the legs. The nurse had observed the edema of the legs. So here patient is on enalapril diuretic therapy heart failure. The nurse should notify edema of the legs and given information to the physician regarding not effective therapy on the patient. So here option C is the correct answer. Next we will move on to question number 25. 30 years old patient has an ulcer over lateral malleolus. Nurse caring for the patient understands the pain of patient is due to. The 30 years old patient is having ulcer over lateral malleolus. The nurse caring patient understands the pain of the patient due to what? We will see here options. Option A edema, option B exudate, option C infection, option D ischemia. Blood will backs up mainly in the veins and it increases the pressure at the vein site. If the fluid becomes excess, then it leads to the formation of the open sore and also leads to a decreased blood supply to the lower extremities, leads to the ischemia. So here option D is the correct answer. Thus understands patient is having pain due to the ischemia. Here we are having ulcers like venous ulcer, arterial ulcer and neuropathic ulcers, but common ulcer is venous ulcer. Here option D is the correct answer. Due to the ischemia, pain is happened. Next we will move on to question number 26. Nurse caring for a retropositive patient with Molluscum Contagiousum. This secondary infection is caused by. This is one of the disorder related to the viral infection. We will see here options. Option A pox virus, option B papilloma virus, option C Epstein-Barr virus, option D herpes simplex virus. We will see here what is Molluscum Contagiousum. Molluscum Contagiousum is a common benign cutaneous viral infection characterized by Molluscum Contagiousum virus. Means Molluscum Contagiosum virus is caused this disease by a double-stranded DNA virus belonging to the pox virus family. Here option A is the correct answer, pox virus. Additionally, one more thing, the Molluscum Contagiousum is a sexually transmitted disease and infection in the adults which can spread by skin to skin contact during the sex. Characteristics like small, smooth, round, pearly lumps with a central core. Treatment of the molluscum is cryotherapy, removal of lesions, and one more thing, curettage and laser therapy also we can treat the Molluscum Contagiousum. Next move on to question number 27. Before moving on to 27th question, sorry for the interval friends. Today a new try from the my side. Nothing but it is expected. Actually till now I explained with all my videos related to the nursing topics with the typing pattern of the questions and answers with explanation. But this video we already discussing model paper. So from 27 to 30 questions, 3 questions I mentioned without typing directly printed paper I kept it. So please tell me no what is impacted on you people. Typing method is impacted on correctly, otherwise this paper is enough to you people. How many wants to me explain questions and answers with typing pattern? Please let me know friends. Without typing like 27, 29, 30 questions like the video, please give your opinion in the comment section. Next further 70 questions and further subjects also I will continue with that method. Please give me a comment section your opinion. Next we will move on to question number 27. Nurse is about to insert Ralph's tube for the patient. Before this act, she must be aware for the distance between incisor teeth and gastroesophageal junction. Which of the following is correct distance? We will see here option. Option A 30 centimeters, option B 40 centimeters, option C 50 centimeters, option D 60 centimeters. In adults, usually the distance from the incisor teeth to the esophagogastric junction in the range of 30 to 50 centimeters is the normal range. The nurse have to know the what is the normal centimeters of the distance between the incisor teeth to the nasogastrical tube. Here option B is the correct answer. 40 centimeters distance is present. Next we will move on to question number 28. A nurse can demonstrate the HIV contaminated waste products with all of the following except. We will see here option A formaldehyde, option B methanol, option C glutaraldehyde, option D sodium hypochlorite. A nurse can decontaminate the HIV contaminated waste products from the except option is methanol, option B. Methanol is an alcohol derivative, has the weakest bactericidal action on the microorganism. So it is not used for the demonstration of HIV of contaminated waste products. So here option B is the correct answer, methanol. Next we will move on to question number 29. 25 years old male patient had sweating, palpitation and found to have blood sugar of 45 mg per dl. Multiple similar episodes had been recorded in the past corrected with glucose. Nurse caring for this patient should consider which of the following diagnosis. 25 years old male is having sweating, palpitation and the blood sugar was 45. Actually he had a same issue, means hypoglycemic issue in several past times. So the nurse caring patient should consider following options. We will see here options. Option A VIP oma, option B insulinoma, option C gastrinoma, option D glucagonoma. Insulinoma are tumors in the pancreas. They make extra insulin more than person body can use. Insulinomas can cause either hypoglycemia or low blood sugars in the body. The low blood sugars can lead to confusion, sweating, weakness and palpitation. If blood sugar levels gets too low, a person can go into the coma as well as soon as possible. So here the option B is the correct, insulinoma. Next question 30. This is the 30th question is last question in the part 1 video of model paper. Nurse is about to catheterize bladder of a pregnant lady. She should be aware that all the following facts about female urethra are true except. The nurse is about catheterizing the pregnant lady means she have to aware of from the following options related to the urethra true except. We will see here options. Option A, it is about 1.5 inches in length. Option B, it's posterior to vaginal orifice. Option C, it's pericet through urogenital diaphragm. Option D, it is a straight and offers minor resistance for catheterization. It is a posterior to the vaginal orifice is not true about the female urethra. The female urethra is located within the vaginal wall and its opening is situated between the labia. So, it is a posterior to vaginal orifice is true fact about the female urethra. So, here option B is the except. Till now we finished from the model paper of related to the staff nurse nursing previous years question paper. 30 question we already discussed in this part 1 video. We will continue further questions from the 31st to further question in part 2 video. Please give me a comment on comment section regarding the which type of method you people want to explain me in typing method or this like last 3 questions printed method. Please friends, like a video, please subscribe my channel, please click on the bell icon for further notification. Anybody watching first time my channel, please subscribe friends and give a like friends, don't forget. Thank you for watching my video. Stay tuned friends.